This is Radio Health Journal. I'm Reed Pence. This week, why your workplace can fire you for refusing a COVID vaccine.
Nobody has the ethical right or the legal right to risk spreading a dangerous disease. It could cause death.
How vaccine credentials can be your ticket to everything when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
If you go back a decade, the thought that you could get something delivered to your doorstep in a day or two after you ordered it was pretty much unthinkable.
Exploring the competitive e-commerce space. Then,
she would flutter her fan according to the Morse code dots and dashes. If one of her spies was watching, they would be able to read the Morse code dot and dashes that she was doing with her fan.
Uncovering the stories of fearless women on both sides of the fight during the Civil War. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
Reaction to the arrival of COVID-19 vaccines has been mixed. Among a lot of frontline healthcare workers, there's been relief and a rush to get the vaccine as fast as they can. Some people farther down the priority list anxiously await their turn. Others want to be convinced that the vaccine's safe and effective before they roll up their sleeves. And some say there's no way they'll ever get a vaccine. But they may not have much of a choice.
Ever since 1905, states have been able to mandate vaccines, and currently all 50 states require childhood vaccinations as a condition of school entry. In addition, private employers can do the same thing. They can require vaccines of their employees, and many do, particularly for influenza. Universities do, businesses do, and many hospitals and healthcare facilities do as well. And it's all regarded as lawful.
That's Lawrence Gostin, University Professor of Global Health Law and Director of the O'Neill Institute for National and Global Health Law at Georgetown University and Director of the World Health Organization Center on Global Health Law.
Right now, states have the power to require vaccines, both of children and adults. But now there's only one state that requires an adult vaccine, all the rest only children. That state's Massachusetts, and it only did it this year for influenza vaccines to prevent the dual epidemics of influenza and COVID-19. But they do have the right to do it, and the question is whether they should, whether it would. The key question is not do they have the legal right? They do. Or is it ethical to do? Yes, it is ethical. The big question is would it be effective? That is, would a mandate actually increase coverage, or would it cause a backlash? We do know that childhood vaccination mandates do increase coverage of vaccines.
We're not to the point of states requiring people to get COVID-19 vaccines. But if they wanted to, Gostin says they legally could. Claims that public health restrictions are illegal infringements of people's rights have been turned down by the Supreme Court.
People do claim they have a right not to wear a mask, but they also claim they have a right not to be vaccinated or even to isolate when they're exposed or quarantined when they're exposed to COVID-19. From a legal point of view, they're just wrong. But I also think they're wrong from an ethical point of view, because I absolutely accept that individuals can make any medical decision for themselves or for their children, so long as it only affects the person who's making that choice. But infectious diseases are different. Infectious diseases, you can spread that infection to a third party or even a cluster of cases. Nobody has the ethical right or the legal right to risk spreading a dangerous disease. It could cause death.
Gostin says that workplaces can legally require vaccines for COVID-19 as well. They protect fellow workers and customers, so they fit under the Americans with Disabilities Act rule that they be job-related and consistent with business necessity. As long as employers provide for disabilities or religious exemptions, very little holds them back.
No, I don't see that there's much that would stop them. The only thing that would stop an employer is as if there would be a backlash among the employees. Even in healthcare settings, it might surprise your audience, but there's a high percentage of nurses and doctors even that don't want to get an influenza vaccine or a COVID vaccine. And so you have to have some respect for what your employees are telling you. But I think overall, hospitals and other employers, schools, they have a strong legal and ethical obligation to keep their customers, their employees, and everyone safe. And it's not unreasonable to ask somebody to get a vaccine when that vaccine is highly effective and extraordinarily safe.
In fact, about the only thing holding some employers back may be the fact that the FDA gave COVID vaccines a quick approval under an emergency use authorization, not the standard approval that puts most drugs on the market.
I think, in my view, it would be unwise to require it under those conditions. But, within a period of time, once the vaccine is out there and shown to be safe, effective, and pure, FDA will most likely grant what we call a biologics license, a full approval. And at that stage, I see the mandates taking place, although it's possible that employers will do it even before that.
Technically, an employer can't force anybody to get the vaccine, but they can say you have to get it if you want to work here. So if a worker says no,
they'll probably get fired. It's as simple as that. An employer can't require somebody to get a vaccine. The state can, but an employer can absolutely either sanction or fire somebody who refuses to get a vaccine. Let's suppose you've got somebody, in a meat packing plant or any kind of a high-risk setting, and the employee says, I refuse to socially distance, or I refuse to wear a mask, or I refuse to stay home if I'm sick. Of course, the employer can sanction that person or dismiss that person because that employee is putting everyone else at risk. Same thing is true with vaccines.
But do employee vaccine mandates have to cover everyone in a workplace? Maybe not. Obviously, bosses can't discriminate on the basis of gender, race, sexual orientation, disability, or religious beliefs. But it may be legal for them to require the vaccine for only customer-facing workers, while letting the back office go without.
Any distinctions you make has to be based upon some rational scientific judgment. And so, you might say, well, people in the back can protect themselves. I can certainly see that being a criteria, but you'd have to show that there's, a risk differential between those you require a vaccine and those you don't. You can't make these judgments in an arbitrary or a discriminatory way. You have to base them upon reasoned scientific evidence.
Many businesses are more likely to encourage workers to get a couple of COVID shots than require it. But as the vaccine rolls out, Gostin foresees a number of industries making sure they're safe by requiring their workers be immunized.
I certainly think we're going to see a lot of vaccine mandates in settings like healthcare settings and hospitals. I think we're going to see them at universities in fall when we're coming back to universities as part of safe reopening plans. And I can see it for certain large businesses that are at high risk, like meatpacking plants. I can see it in nursing and other long-term residential care facilities. And then it'll be very interesting to see whether transport carriers do it, airlines, train services, whether they require vaccines. That will be a very interesting and very feasible future that we might have.
One place that Gostin sees as sure to require COVID vaccines is at school, both for teachers and for students, once they're approved for children. Schools are key to kids' social needs and mental health as well as academics, and they're also key to getting parents back to work and getting the economy moving again. So a school reopening that's guaranteed safe will be important.
I think under the Biden administration, school opening and school attendance is going to be a very high priority. And so while we may be closing bars or restaurants, we want to get schools back up and running really quickly. I can absolutely envisage, once COVID vaccines are proven safe and effective, that children may get them, and certainly teachers as a requirement. But schools have high social value in our society. Getting them open is really crucial, and I can see vaccines being one important linchpin in the reopening of our schools so we can educate the next generation of students.
However, might COVID vaccine requirements go farther than that? A year from now, could a restaurant say you can't eat here unless you've had a COVID shot? Would it be legal for a sports venue to keep fans out unless they can prove they've gotten the vaccine?
It could be, yes. You're certainly entitled to deny a service for somebody if that person poses a risk. So just imagine, a sign up on the door that says you can't come into this establishment, or you can't come into this sporting event or shop carrying a firearm. If there's a risk that you could pose a threat to others and that would make the business unsuccessful and dangerous, it's possible you can. It's very difficult to try to implement that kind of a system, though. These are what we are calling in my field kind of vaccine passports. That is, you need proof of vaccination to get on a plane, to go to a large sporting event. It may very well be that the Tokyo Olympics are going to require these kinds of vaccine passports.
Many experts believe that vaccine passports are likely in the future. They may be the only way to fully open schools, restaurants, entertainment venues, and businesses without worry. There is precedent for it. Even now, you need what's called a yellow card to travel to some countries.
Internationally, there's only one disease in our history that requires a passport, and that's yellow fever. WHO recognized yellow fever certificates that you need to show to enter a country if you've been from another country that has yellow fever. I can foresee it, but the implementation of that is difficult. How can you avoid forging these kinds of documents? How will you really be able to demonstrate proof that you've been vaccinated? So I think having customers or people in sporting events, fans showing proof of vaccination, I think it's really great in theory, but how you would implement and enforce it is going to be extremely difficult, and especially in the United States where we have such inadequate data systems for health vaccination registries.
Vaccine recipients will be given a card to be sure the manufacturer of their second shot matches the first, and a number of private companies and nonprofits are devising smartphone apps that they say can be used as a vaccine credential and that are more secure than easily forged paper documents. But either way, if vaccine passports are required for entry to many places, they'll create a two-tiered society, the haves and the have-nots. The haves can get back to normal sooner, free to dine, play, and congregate as they wish. And that may encourage a lot more people to go ahead and get that vaccine. I'm Reed Pence.
A good night's sleep means everything no matter where you are. Luckily, there's a CPAP machine for home and away. The Philips DreamStation Go offers the best of both worlds, a lightweight and discreet travel CPAP designed for everyday use that can be carried wherever you go. Dr. Mark Aloya is Global Lead for Behavior Change at Philips Healthcare.
Most people don't realize that missing just one night of CPAP therapy, which happens often when we travel for business or for pleasure, can put you right back to square one. Now there are more options than ever for CPAP therapy with the recent introduction of travel-sized CPAP devices like the Philips DreamStation Go.
Whether you're at home sleeping soundly or chasing a new adventure on the road, the Philips DreamStation Go is the everyday travel CPAP you want by your bedside. Find out more at philips.com/DreamStationGo. That's PHILIPS.com/DreamStationGo.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
They did not want to be judged. They didn't want to hear how bad the behavior in question was for them. They were embarrassed.
Fibbing to our doctors. Almost everybody does it for what we think are good reasons.
Then an unhealthy byproduct of avoiding germs during the pandemic.
This clean living to the extreme, which on the one hand is necessary, but on the other hand can potentially cause us problems because of our lack of exposure to these good microbes.
All that and more on Radio Health Journal.